One. It's the front and back. Okay. There are two plans that are being offered through UHC, and UHC is for United Healthcare. United Healthcare is the carrier that the plan is currently under. Okay. So we have UHC Choice HMO, ASOT, and then UHC HSA HMO. The difference between the two of these is this plan right here, ASOT, has a higher premium but lower deductible. This plan at the bottom here has lower premium and higher deductible. Okay. So for the first one, the deductible here for family is 1,000, and for individual is 500. Okay. For this one here, which is the HSA plan, the deductible for individual here is 2,500, and for family is 5,000. Okay. So every 2 weeks, if an employee decides to choose this plan, right, the one with the reasonable or lower deductible, you can say, they will pay $145.77 if it's an individual only. Okay. That's per pay period. So every 2 weeks, they'll pay $145.
Wow.
So for if it's an employee and spouse under the same plan, their deductible will be this amount here, $335.77. And if it's employee and children under the same plan, it will be $269.67. And if it's for family, it will be $443.13. Okay.
Wow.
The next plan, which is the HSA plan, that has the lower premium. If it's just individual, they'll be paying $67.42. If it's employee and spouse, they'll be paying $155.07. If it's employee and children, they can pay $124.73. And if it's family, it's $204.96. Okay. So enrollment can only happen the first of the month. Okay. So when someone is newly hired, it has to be 60 days from their hire date. Okay. 60 days from their hire date. If they're full-time, meaning 30 hours and above, okay, they're eligible to sign up for the health insurance, and they have the choice to choose either one of this plan. So this top portion here is just medical coverage, okay, medical and I guess prescription, you can say. Then at the bottom, as you see here, we have dental coverage as well. Dental coverage is offered through Care First. Okay, so the medical and the dental plan are under two different carriers. Okay. The medical is under United Healthcare, and then the dental is under Care First. Okay, so for dental, if an individual wants to take the plan, it's $8.41 every 2 weeks. So per pay period, $8.41 will be deducted from them. If it's employee and spouse, it will be $19.35. If it's children, employee and children, it will be $15.56. And if it's family, it will be $25.58. Okay. The plan also offers vision, voluntary vision, and that is through United Healthcare. But the employee is solely responsible for the full premium for this plan. Okay. So for the medical and the dental, the company, which is Capital Care, shares it with you. Okay. But for the visionary, the vision, you as the employee are solely responsible for it. So that's why it says voluntary vision. Okay. But that is also offered under United Healthcare. So if it's just employee, the employee is responsible to pay $292 every pay period. If it's employee and spouse, they'll pay $5.53. If it's employee and children, they'll pay $6.49. And if it's family, it'll be $9.13.
Okay, I have a question. This amount, do they include the what the employee should give and the employee and employer, or it's just
so
for
this is
employee?
Primarily just what the employee.
Okay.
So that's why I said you see the headings here. It says employee, and spouse. This amount is already deducted from the portion, the original premium that is that is supposed to be. So the employer pays 50% into this one if you go with this plan, okay? And the HSA plan, the employer pays 70% into that plan, okay? So these portions here already are solely responsible for or are towards the employee, okay? So now the employer can choose. They want, for example, if they decided to go with the first plan, which is the ASOT with the higher premium, they can choose this. If they decide they want to do dental, they can choose dental. If they decide to do vision, they can do so. So they have the option to choose all three, okay? They have the option to just do one. So it's vice versa. It all depends on how the employee fills it out, okay? So normally with the HR, when the HR is going to hire, the HR will give out this information, okay, to the employee, and she keeps a record of the 60 days from the hire date. So she will let you know prior to the 60 days actually happening, okay? So when she gives you that form now, the next thing you're going to do, they're going to enroll. So if they're going to enroll, they will check off either one of these portions here, okay? So if it's a new enrollment, it's just going to be let me see here, new hire. They will check off new hire. So open enrollment happens once a year. So around August or come prior to August, you and Miss Lum will kind of work closely together to try to get a new plan for the following year, okay? So this plan actually is going to expire come this August 1st, okay? So if it's new hire, any hires that are going to be done in between from now till August, they'll just check off here. Now, if they don't want the plan, even though they're eligible, she's still responsible to give them this form, right? So what you see, they will check off waiver, right? So when she gives it to you, I have a folder down here. It's kind of full now, but you can create another heading or another folder for yourself, okay? If it's waiver, you just put the form in that folder, okay? You can get one such as this back there, or you can ask her to get one like this for you, okay?
For waiver.
Well, you want one for waiver and for enrollment. It's just to differentiate them, okay? So if it's waiver that the person did it as, you put it in the waiver form and you have nothing to worry about, okay? Hold on 1 second. Hello? Hey, good, how are you? Yeah. The forms, you put them respectively into the folders according to what it is that they did, okay? So now let's say if the person is actually going to enroll, okay? So I showed you stickies on, I have stickies here, right? It's for me to eliminate putting stickies everywhere, but my stickies are here on my desktop. So for you want to enroll somebody into this system, this is the user ID. So let me put here United Healthcare. I can just abbreviate UHC. Caps. UHC info, okay? So in terms of enrollment, you want to go under this website, okay? Employerservices.com, and then this is the username. Now you can choose to change the username, okay?
I'll leave it.
You may want to change the password too. I keep it pretty simple. I try to name everything under him or something. Yeah. So you can change. You have the option to change it, okay? If you need to do that. But for now, this is what it is. So you go onto the website, and I'll show you what it looks like. So this is the window. If it opens up. So this is it, right? So where it says user ID, you want to copy and paste this user ID right here. Copy and paste. And then the password is right here. You want to copy that whole thing, copy and paste, okay? and then you hit login. So if you want to change the password, there is
don't worry about it.
okay. So login, and then it will take you to our company profile. Okay, so this is United Healthcare. You see here it says Capital Care Inc., and this is our group number. Okay, this is also the same information I kind of put up there, but it's like more of a contact list. So here is the rep that I normally talk to regarding payments. Her name is Ultra Garcia. I call her Ms. Diaz, and this is her direct number right here. Okay. So if you have any issues with payment, or if you need to talk to her, that's her number right there. You can just call. On here, these are the different headings pretty much that you can utilize. So in terms of invoices, you will have to print out the invoice for Miss Loom. Pause one moment. One second. This is due, okay? So we have an invoice that's coming to be due for next month here. So all you need to do is just print this page for her, okay? So you right click and just hit print, okay?
Also give it to me, Lucy, just in case.
Okay, no. So what I have, on my computer, I have sticky notes that have all those information on them.
Okay.
So my computer normally logs out. So obviously when Alex sends everything on the login and all that stuff, it creates his own password. So it's not like somebody can log in to see that information.
No.
And he also has.
Oh, Farley, can I get their files so I can send out the email?
So yeah, so we'll just print. So I'm just gonna just print this one out here for her now, okay? So the first of each month.
I didn't see what you did.
So I just right click and then hit print, right?
Oh,
and then the
this
print.
is what you printed.
Yeah,
Okay,
I'm printing
okay.
this
I thought it's another page.
cover page for her so that she can see the invoice to be paid
Okay.
by next week, okay? So you log in here at least once a month if you don't have any new enrollments to add, or if you don't have anybody to terminate from here. You log in at least once a month in order to just print the invoice out for her, okay? So now let me close this window, and it brings you back to the main page. So now if you're enrolling someone, you're gonna click here on the add new employee, okay? So when you click on the add new employee, it's gonna ask you original effective date. So the effective date, if you want to put, is the date of when the coverage should begin. Enrollment can only happen the first of each month, okay? So maybe let's say the person is supposed to start the coverage is supposed to start effectively the first of next month. So you put 0401, 2019, right? And then now you put in this information from their enrollment form. So the person would have filled their name, their last name, their social, their address, all their personal information. So then you put that information here, okay?
Okay.
And you just continue. So all the red asterisks is what you need to fill in, okay? I'm not able to go forward now because nothing, I'm not enrolling anybody. But once you do that, you'll just follow the next prompter. It'll prompt you, what to do next one. But just know that every red asterisk, you need to put in an information in there, okay? All right. So it's the same format. Let's say you're going to.
So it has three steps.
Exactly. There you go. So you can complete first page, add an employee, assign plans. So assign plans is this information here, the medical. So are they choosing this coverage or are they choosing this coverage? Okay. So you choose depending on what the employee stated down, and then review and then submit. Okay. So the next thing that you do here is to terminate employees. So I'm just gonna go back one screen. Yes. Okay. Under here now, see invoice. Okay, let me just pull up somebody. So you click on the person's name, and it's It says it has it right there.
Mm.
So if you want to terminate somebody, again, if somebody becomes inactive, when she tells you, and she has to let you know this, so
Oh,
the
okay.
HR.
Okay.
So when somebody becomes inactive, if she gives you the name, you want to cross check to make sure that the person is not on the health insurance plan. Okay, if the person's on the health insurance plan, you want to type in their name, and if their name pops up, you just hit terminate, right? And termination, the plan ends pretty much at the end of each month. So let's say the person gets terminated today, they will have the plan till the end of the month. Okay, so even if they terminate at the first of the month, the coverage will end at the end of the month. Okay, so
Okay.
first of the month is when you enroll. You can only enroll, and then end of the month. So it's pretty much month to month is how the plan is. Okay. So again, with this, I can't go any further because
So after this, there's another step.
this is in terms of terminating. So if you're terminating, you want to type in the employee's name. Their name will populate down here at the bottom of the screen. You click on it to open the page, and at the bottom it will say terminate. Okay, so you just hit terminate on here. If it's maybe the name, the employee's name was spelled incorrectly, then it's the same thing. You type in the name. It's not necessarily you're going to terminate them, right? You type in the name, and then you hit edit, and under demographic, you edit whatever it is that you need to edit, right? Because it's their name, their location. What are you guys eating? Sure. Salad? I didn't get to it. Okay. Then you do that, okay? So that's pretty much it. If it's, they really can't change their medical coverage because it's locked in, you signed up for it, you pretty much done. The only time you can make adjustments, let's say, it will be in the beginning of the enrollment, like when you're first, everybody's trying to enroll. Yes, within a week's window, people can go back and forth and say, oh no, I want to switch this, I want to switch that. And you work closely with the broker in order to make that happen, okay? But once it's gone further,
After maybe a year, if somebody want
well, the plans are only on a
change
yearly
plan.
basis. It's only on a yearly basis.
Oh,
So
okay.
this was from last year, August 2018. So that's what I was telling you earlier. It's going to expire come August 1st. But prior to August 1st, you and Miss Loom will be working towards that to try to get a new plan. Okay? So it's only yearly. Every year they renew. Okay? So that's pertaining to health insurance.
Okay.
Right? Okay. You got a question?
Yeah.
Okay.
If somebody is enrolled and after 3 months doesn't work anymore with the company, we're just going to terminate.
Well, that's what I said. So whenever if the person was on the plan, right? Let's say Miss Tigger tells you today, oh, so person A is no longer working, right? You want to check into the system to see if that person is active, right? So you type in the name. If that name doesn't come up, then it means that the person is not enrolled, right? It means that you don't need to do anything here. But if the name comes up, then because it's termination, you want to hit on the terminate button, right? And when you go to the next page, it's going to ask you for the date that the person became terminated. So if it's today's date, you put in today's date. The system will give you a pop-up screen to say, oh, well, the person has the insurance to the end of the month. Okay? And you just hit okay. So that's it. So after the end of the month, it'll just knock them off the plan. Okay?
Okay.
So pretty much that's how that works. And now let's say the only time you can have or you can add additional enrollment is you can add additional enrollment to existing participants of the plan if, like, say they have a newborn. If they have a newborn,
Yeah.
if they adopt a child, or if they become married, or if they're divorced,
Yeah.
or if they become widowed, you are allowed to change the plan. So maybe if somebody was becomes a widow and they had their husband on the plan, you want to change it now from employee and spouse to just only employee, right? Depending whatever the plan was, okay?
And depending on what they want.
What is they already have a plan, so when they sign on, there's only one thing they're gonna be able to do. So let's say, for example, they had this plan, right? And let's say it was an employee and spouse, and let's say the employee spouse, passed away unfortunately. What happens? You have to go into the system, and it has different reasons as to why you're terminating a plan or why you want to edit a plan. Okay, so you look for that reason to say spouse deceased, right? And the system will automatically make those changes effectively. Also, what you need to do, you can send an email to the broker. I'll show you who the broker is and his information. You can send an email to the broker and say, oh, participants so and so recently lost their spouse, so now their plan needs to be under just an individual, right? And he can ensure to make sure that change also takes effect into this system. Okay. So now you will have to go back into the system, into the payroll system. Mind you, they were paying $335.77. Now their rate will go down to $145.77 because it's only them, and that's only if they only had the medical. Now, if they had all three of these, it means that all of these amounts will change respectively, right?
Sure.
Okay. And again, if it's a newborn that they had, all you're gonna do, you just add in. So more than likely, it would be employee and children, or it will be family plan. So it will be either one of these two plans. Okay. That's pretty much it in terms of the health insurance. Anything you're not really sure of, you can always reach out to the broker. You can send an email and explain to him what it is, and he can guide you or direct you the best way possible what to do.
Rob?
The broker for the health insurance, like this.
Okay.
Broker, health insurance broker.
Okay.
So it's like kind of like the middleman. He's the person that like when you guys are gonna have the health insurance renewal. He's the one that is gonna search for the new plans in terms of the cost of the premiums, and then now you and Miss Lynn will sit down, or all three of you will sit down to figure out, what plans is it that you want. Okay. So the broker gets involved, and you can reach out to him anytime throughout the plan in the year. Okay.
Okay.
So that's pretty much pertaining to health insurance. Any other question? Or if you're not sure in terms of doing it on your own, again, you can scan this document, and email it to the broker and just say, okay, this is a newly hired employee. But more than likely what you want to do, you want to be able to enter this information in. Okay? So again, if you need help to do it, if you're not sure, again, you can call him and he may direct you to speak with any of the assistants on the UHC, and they can guide you through how to input the information. Okay, but it's pretty straightforward. When you log in, you just follow the steps. Okay, so that's pretty much it.